This is Dilip Pai. He loves his job as an auto rickshaw driver, where he earns 5,000 rupees a month. Enough for a living, but making savings for medical expenses, no chance. When Dilip Pai experienced severe chest pain, the doctor advised an immediate surgery. The family did not have the money to pay for it. Luckily, friends told Dilip Pai about the National Health Insurance Scheme, PMJ. He found that he was eligible, so he got his card made and got an appointment for a surgery. So what is PMJ? Ayushman Bharat Pradhan Mantri Jan Arogya Yojana was launched in September 2018. With PMJ, India improved the health services for its people, especially for the poor ones. This scheme is for people who cannot afford health expenses out of their pocket, as well as for those who are informally employed. PMJ is much improved than the former scheme, Rashtriya Swasthya Bima Yojana. Today, more than 650 million people are covered by the scheme. Every family gets a cover of 500,000 rupee per year. For every hospitalization, PMJ covers up to 3 days of pre-hospitalization and 15 days of post-hospitalization expenses, such as diagnostics and medicines. And has a strong impulse to empower women. 19% of women asked in a survey said that it was difficult to get permission for the treatment from a family member or husband. PMJ provides a large number of secondary and tertiary health conditions exclusively or even primarily for women. With PMJ, India has taken major positive steps towards achieving universal health coverage. To improve the impact of the scheme, a research project was done by the GIZ's Indo-German Programme on Universal Health Coverage, in partnership with the University of Heidelberg, King's College London, the German Development Institute, and Indian research partners. The survey covered insurance members and patients of 15,000 households in 7 states, and people who offer medical treatment like nurses, doctors, and administrative staff in hospitals. People in the survey were asked, "Do you know about PMJ?" Evaluation was conducted 1 year after the scheme launch, and by then 62% were already aware of it. Respondents showed a high satisfaction with the verification process. Many respondents that were covered by PMJ reported that they have spent money from their own pocket before, during, and after they were in hospital. But there is already good news. People covered under the scheme spent on average less than half the amount of people not covered by the scheme for a single hospitalization. Thus far, all states and union territories are covered except for 3 states: Telangana, Orissa, and West Bengal. PMJ enabled hospitals to provide better quality services. And as the evaluation shows, a majority of hospitals report a good and supportive engagement with the PMJ support team as well. More than 20 million people in India benefited from the scheme. How can government further improve the impact of PMJ even more? New strategies can help to further increase the awareness of the scheme. Barriers to access to healthcare can be identified and removed. New feedback channels for beneficiaries are helpful, so patients can voice their concern and give feedback. Additional manpower and training for hospitals can help to cope with the challenges in beneficiary management and claims submission. With the launch of PMJ, India is moving towards universal health coverage. And just like Dilip Pai, many others can now access healthcare through PMJ.